Nursing students, stop scrolling if you want to ace the GU content on your next med-surg exam. So two of the most commonly tested and most important urinary disorders you're going to learn include glomerulonephritis and nephrotic syndrome. So over here in the pink column, we have glomerulonephritis. Our etiologies can be infectious or non-infectious. Infectious causes for glomerulonephritis include group A beta hemolytic strep, also known as strep throat. Non-infectious causes can be lupus or Goodpasture syndrome. These are both autoimmune disorders that cause massive inflammation and damage to the capillaries within the glomerulus. So, moving on down to the patho. Immune complexes. It's in bold for a reason. So, these immune complexes that are formed because of an infection or because of an autoimmune issue are directly damaging the glomeruli and damaging those capillaries, causing red blood cells to leak out, which leads us to our signs and symptoms, which include massive hematuria, okay? Remember, we're leaking out red blood cells, so those are going to leak out into the urine, and we're going to see massive hematuria. We're also going to see anemia because we're losing red blood cells in the urine. Oliguria, which is defined as a urine output of less than 30 milliliters per hour. Edema here will be mild. Proteinuria, which is protein in the urine, will be mild. The urine will be Coca-Cola colored. Sounds good, doesn't it? So, moving to the diagnosis, we're going to see severe hematuria on the UA. We'll see some mild proteinuria. We'll see edema within the patient. More specifically, periorbital edema or edema that's around the eyes. Also, the patient, if it is an infectious cause, the patient will have a positive ASO titer indicating a recent strep infection. So as far as nursing care, we're always going to watch that urine output and make sure that it's staying above 30 milliliters per hour. That's our magic number. We're going to monitor the patient's blood pressure because they are at risk for hypertension and fluid volume excess. That's FVE. DVT prophylaxis is very important with these urinary disorders because of the hypoalbuminemia, because of the damage to the capillaries. These patients are at risk for DVT. And we're also going to implement fluid and sodium restrictions to prevent further fluid volume excess. So looking at nephrotic syndrome over here in the blue, look at our etiologies. Our first etiology is glomerulonephritis. So glomerulonephritis, if it progresses far enough, can cause nephrotic syndrome. Lupus, again, here comes lupus again attacking the kidneys. Lupus is absolutely devastating to the kidneys. Diabetic nephropathy and also NSAIDs. So the patho here is pretty similar, but there's even further damage to those glomerular capillaries. All right, so now this massive inflammatory response that has been triggered is going to cause massive leak of proteins. So proteins versus red blood cells, okay? So the result here is going to be massive proteinuria. We are losing so much protein, like over 3 grams of protein a day being lost in the urine. Hypoalbuminemia. So albumin is our primary plasma protein, but it is leaking out like crazy in patients with nephrotic syndrome. Here we're going to see edema as well. And instead of cola-colored urine, we're going to have tea-colored frothy urine with nephrotic syndrome. So as far as the diagnosis, proteinuria is going to be very severe on our urinalysis. Hematuria, by contrast to glomerulonephritis, is going to be mild. We'll also see urinary casts on our urinalysis, okay? As far as nursing care, it's pretty much going to be the same as for glomerulonephritis. We're going to watch that fluid volume status for fluid volume excess. We're going to monitor blood pressure. We're going to monitor urine output. Again, DVT ART prophylaxis is very important for these patients as well. We're also going to be hitting them with a bunch of corticosteroids to try to counteract that massive inflammation. And also, they're going to be getting diuretics at this point because once we progress to nephrotic syndrome, fluid volume excess is a real concern for these patients. So I hope this has helped. Happy studying, happy semester, and go Vols.